Today we're announcing 26 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 262. There are currently 6 individuals in hospital, and I'm pleased to tell you that 52 people have now recovered and their cases of COVID-19 can be considered resolved. Overall, most of our cases have been connected to travel or a known case, but we now know that this disease is in our communities. That's why we're adjusting our testing strategy. We want to have more options to identify and test for COVID-19 in communities. We need to be flexible and be able to react quickly to the path this disease may take in any community in Nova Scotia. To that end, we're working with our partners in the Nova Scotia Health Authority, both Public Health and the Microbiology Lab, as well as 811 and EHS to offer more testing options. When we identify communities where our surveillance suggests increased disease activity, we may stand up temporary assessment centres if there isn't a centre in close proximity. Today, we opened the first of these centres in Elmsdale. We're aware of increased disease activity in the East Hants corridor, Elmsdale and Enfield, and so we're moving in there starting today with enhanced testing. These centres, it's important the public to know, these centres are not for walk-in. They will operate the same as other assessment centres do now. People must be referred for testing via 811 or a primary care physician and receive a scheduled appointment. How long these temporary assessment centres will stay open in any one community will depend on the disease activity that we pick up and the needs of the community. In communities where there isn't an appropriate facility that could be used as a temporary assessment centre, NSHA is also working to establish a mobile assessment unit. This would be a portable unit in a large truck that could be brought into communities temporarily to do screening and testing. EHS also has 2 mobile units in two SUVs staffed by paramedics who have been trained to do at-home testing. These will be used in situations where there are people who have mobility issues and cannot get to an assessment center, or in situations where there's a group of people where testing needs to be done, for instance, in a long-term care facility. There'll be each of these mobile units, there'll be one in HRM and one in CBRM, and a decision on the use of these units and where to deploy them will be made in discussion between Public Health, 811, and EHS on a situation-by-situation basis. I'm also very happy to report that as of tomorrow, the lab will be operating 24/7. This will allow them to process well over 1,000 tests a day if necessary. I want to take a moment to thank everybody involved in developing and standing up these testing options. A lot of people have worked long hours very quickly to work through all the details of how all these different testing options will work. And it's a testament to our ability to work as a single health system that all these various parts of our system have come together with a sense of urgency and working extremely collaboratively. So I want to thank everybody involved for those. I also want to talk to employers today. As we get more cases, workplaces all over the province are being impacted. From what I'm hearing and from my medical officer of health colleagues, that employers are taking this very seriously and following public health advice. But I want to take a moment just to clarify how public health follow-up works and how workplaces will or will not be involved as necessary. When someone tests positive, all of their close contacts are notified by public health. If a workplace is involved, public health will work with the employer and the employees to identify and manage people who would meet criteria to be considered to be close contacts, as well as giving advice on any special measures such as cleaning that's necessary for the workplace. If a workplace isn't notified, even though one of their employees may have been identified as a case or a close contact somewhere else in the community, that means there's no exposure in the workplace and employees can continue to go to work as usual and normal. We are seeing some circumstances where a workplace goes into chaos and shuts down simply because one of their employees has been even suspected and is going of COVID and going in for testing. If a workplace is impacted, employers and employees will hear from local public health, and public health will give appropriate and necessary guidance. It would be a rare circumstance for public health to advise shutting a business down completely. I recognize that some employers may feel more comfortable making that decision. That is your choice. But as we've said many times, it's also important that businesses who can stay open do. Last week, we launched a new tool for employers and businesses who have questions about whether or not they can remain open and what they need to do to stay open under the orders under the Health Protection Act. That website's been widely used. In the first week, it's had almost 10,000 visits. If you're an employer and have questions, that website is a great place to start. It's on our coronavirus website, novascotia.ca/coronavirus, and look in the section Supports for Nova Scotians, Individuals, and Businesses. I'd like to close by saying that coronavirus is here in Nova Scotia. It is in our communities. Expanding our testing options means we have the ability to act quickly if we see clusters of disease in communities or locations or settings, and that ensures we are able to accommodate vulnerable Nova Scotians and those living in hard-to-reach communities. But testing is only half the battle. We can't be fooled that simply knowing how many people have the virus and getting them to self-isolate will completely slow this virus down. We have to continue with the public health measures, keeping physical distance, only gathering in groups of more than 5 if absolutely necessary. You've heard the Premier on Friday, stay the blazes home, and that's really important. And I want to unpackage that a little bit because I'm hearing, even this weekend, of a number of situations that people, even though most Nova Scotians are getting it, and some Nova Scotians are not getting it. The first is about shopping. It's important that people do essential shopping only. Now's the time to do online shopping as much as you can. And if you do, and it's essential shopping is gas, groceries, going to the pharmacy. Please plan ahead. This is not the time to say, oh, I need 4 things at the grocery store, and I'm just going to pop down. Make a plan. You should not go shopping more than once a week. Some people are even doing it twice a week. Work together as communities. I know my household, my wife is working as a group of 7 homes that are sharing the load for shopping. So one of them, he was taking the job and says, I go to Costco every week or every 2 weeks. And by email, they say, who else needs some things from Costco? So one person shopping is actually shopping at one location for 7 households. Think about how you can support each other and be creative to minimize the number of people going in and out of stores. I'm also hearing a lot about people, questions come to me, can I just drive for socializing? Now is not the time to be going out and about our communities unless it's necessary. Like the Premier has said, walk for exercise, not to socialize. Please, now is not the time to drive just to socialize. You may think that it's okay just getting in your car and driving about, but the fewer people we have on the roads means fewer trips to gas stations. It also means that there's a less chance of an accident, and we have to have our healthcare system, which is stressed right now, deal with people that may be injured in a motor vehicle crash. Along with that, we're still here. Lots and lots of people are using online, I'll call it flea marketing, Kijiji and Facebook online market. It doesn't make sense if we're saying to people, stay at home only and only go out if it's essential shopping. Now is not the time. I know lots of people are using the time at home to do spring cleaning and put things online, but now is not the time to drive around. Even if you say, I'm going to pay you electronically and pick it up at the top of your driveway, people's hands have been on those things that you're picking up. You're still going out doing non-essential driving. We need to be able to stay at home as much as we can, only go out and about beyond just walking in our communities if necessary. The last piece, as the weather gets nicer, we have more and more people that may be thinking about either they can start to go to their cottage if their cottage is a year-round cottage, or starting to go and open up their cottage. Again, now is not the time to do unnecessary driving and trips. You may think that you're going from one home to another and you're taking your groceries with you. And yes, any one family, that's a low risk. But if we put that all together and have more and more people driving around, having to stop for gas, all those things, the more movement of people we have around Nova Scotia, it creates a substantive increased risk for all of us. So what may be a low risk for one family can lead to a large risk for all Nova Scotians if lots of people are doing it. So if you have a cottage and it's year-round, choose one place or the other. Go there and stay there. Make that your home. Don't go back and forth between multiple residences. You're going to have to leave your cottage. If it's not open yet, you're going to have to wait. Hopefully we'll start to get out of this by in May into June. You're going to have to wait till then to go out to your cottage. Please choose a home. Stay as close to home as much as possible. I was telling the Premier I was reading a paper in the last few days that based on some modeling that showed that it needs at least 80% of the population to strictly stick with public health measures for those measures to actually have the impact that we need to have to decrease transmission of the disease. And if you have more than 80%, you get better, stronger and stronger effects. But all it takes is a slip down to 70% of the population adhering to public health measures and 30% not, and you have no effect at all of the public health measures. The message is that all Nova Scotians, every single Nova Scotian needs to do their part. It doesn't take very many of us to not doing what we need to do, and then the hard work that everybody else is doing and the pain and sacrifice that everybody's doing is for naught. So please, every Nova Scotian, do your part. Don't think about yourself. Think about your community. Look after one another, but put everybody else in your community first ahead of yourself.